What are you doing? Are you having a steering contest with the future of digital health? Who's gonna blink first? It's the August 4th episode of Health Tech Deals.
I win. If you
You're
blink
right.
twice, you're supposed to come and rescue me, or you're supposed to short tell a dog. One of the two. All right. Well,
Oh my
what?
God. Hey, speaking of Teladoc, how about these earnings reports? Let's start with theirs. I feel like, I mean, how has demand gotten so low? How is Jason Gorvick still there? What is going on?
Well, I mean, look, it's theirs is still because they paid a lot of stock. They paid some cash, but they paid a lot of stock for Luongo, and they're still steadily writing it off, and devaluing. To some extent, it doesn't matter that much. Obviously, the original stockholders got diluted, but people who bought in since then, bought into the whole mess, not the original mess. So anybody who bought in since when we did, or I did, last year is already holding the bag for that whole thing. But I think you're right. They're sort of inching back towards profitability, but they're not there yet. Even Amwell is still losing a ton of money, but the demand is not as strong for those telehealth products as we were kind of thinking. And I met a Marty Phillips, a VC, at a party a couple months ago, and he said, the worst problem for these guys was the pandemic because it meant that everyone had to do telehealth, so people realized they didn't actually need NB Live or Doctor on Demand or Amwell or Teladoc. They could do it with like an iPhone and FaceTime and
Zoom.
Doximity and DoxyMe and Zoom all came in and so they're having a bit of trouble reestablishing themselves. But if you look at the whole sector, right, since the dog days at the end of May when we were all slitting our wrists, it's actually, June was bumping on the bottom. July picked up a bit, and August has been okay the first couple of days. And, so they're off the bottom. Then we have, One Medical being bought. And,
Well, speaking of that, I think Axios had it, and I can't remember who said it, but somebody had said that they were predicting that CVS Health might buy TDoc because they have said in their earnings that they want to get into that primary care space. And it's like, that's the way to do it.
Well, I mean, they've got a clinic. They've got the clinics. They don't really have the telehealth thing. You've got, but they and Cigna, which, compared to that, are bought NB Live. So are they really going to become a combined provider? Do they need it or can they do it themselves? I mean, Teladoc's still pretty expensive, right? In terms of, it's double the size, double the market cap of One Medical. I think so. Hard to tell these days. Certainly, it's not where it was a while back. It's not the $40 billion company it was at one point. Oh well. All right, should we figure out what other deals have been done? Because there is still happening.
Yeah, there is stuff happening. Not if you're a digital health point solution, but if you're anything else.
There's one or two in here.
Do you have your timer?
I found my timer.
Finally. All right, you ready to go? Let's do it. Okay, Everside Health gets 164 million, raised their total up to 329. This is a bunch of worksite clinics. What else do we know about them?
Yeah, this used to be called Paladina Health, and way back when it used to be owned by DaVita, the clinic care people who also sold Healthcare Partners, the LA chain, to Optum. So it got spun out. So this is kind of like lower class One Medical on the work side, a bit more like Crossover Health. They have like 350 clients. And this money is from NEA, right? So big money. OKCF is in this as well. But this is a serious challenge. And I think the future of work site is non-trivial. In other words, there's plenty of options for people who want to have a work site primary care group and think that will save their overall money. A bit like the way Amazon's doing with their doing it with Crossover in the warehouses, not so much with One Medical.
All right, what about Particle Health? They get 25 million, brings their total up to 39. This is an API play, but these kind of confuse me. Do you know the difference?
No one knows the difference between these guys, Redox, Human API, Health Gorilla. It's all the same stuff. The reason I put this in is the CEO is the former Kim Kruger's intern at Health 2.0, Troy Bannister, CEO, also worked at Startup Health. The only person who's ever worked at Startup Health and Health 2.0. And Cannabis Ventures, Rebecca Lynn, who doesn't do a lot of investing, but was in our favorite Doximity and a bunch of others. She's the main lead on the investor side.
All right. And what about Annexus Health? They get 33 million. Things are up, a total up to 43. I have no idea what this does. Transformation.
Yeah,
capital.
this is helping Transformation Capital. Pretty much the crew in this. This is helping for oncology drugs. Figure out how do you get access to all those programs that enable financial assistance for oncology drugs. This is kind of a front for help for drug companies to sell more expensive oncology drugs. It's one of those weird things that happens only in America, but hopefully it does something good.
All right, 5 months after their launch with the $20 million round, Homeward lands a $50 million Series B, and they announced a partnership with oh my God, I'm blanking.
Priority Health. I have my notes. So your buddy Jenny Schneider is active again. Did you notice that I did a little interview with her like 10 minutes before she announced Homeward, and she kind of vaguely mentioned rural health and said she was doing something, but didn't let these. And then you have all these interviews with her, but
I have this interview with her on this, which is really interesting.
She said she wasn't looking for the money, but somebody forced $50 million into her, forced it into a waistband while she wasn't paying attention or something. I don't know.
She got strong-armed by Hemant Taneja, Glenn Tullman, Lee Shapiro, the personal money, not Seven Wire money, and then the people who actually co-led the round, Arch Venture Partners and Human Capital. So, she said she wasn't looking at all. They were just here, take it. And
so if you think about it, right? So Particle is heading, Everside is heading to the work site. They're going to be doing mobile and primary care, mobile primary care in rural clinics. And that's going to be a big investment, just for Michigan. If they got this deal with Priority. 30,000 patients spread across a big area. There's going to be a lot of infrastructure required, not only in vans and getting doctors and nurses and people out to these places and setting up regional centers and mobile centers and all kind of stuff to basically raise the game, the level of primary care for rural health. But also a lot of these people are going to require, monitoring. They're going to require hotspots. There's a bunch of technology stuff in there. Right? I know that she's got a bunch of the old Livongo crew around to help out on that, and it should work. But to me, if you are going to build a really big primary care practice in rural America that's mobile, no one else has really tried to do that, right? And part of the reason why there's little infrastructure out in rural areas is because it's bloody expensive to put infrastructure out in. So I hope, my fingers are crossed to Jenny and the crew there that this is good and that they don't end up having to raise $1 gazillion to service not that many patients, because that has essentially been the problem with rural health.
That was the thing, though, that we talked about, was the economics around it, and this fact that they are doing this infrastructure play at scale. But I said the same thing. I'm like, well, it doesn't seem like it's that many patients. She said that she's like, when she was at Livongo, the number of people, the market for diabetes was 30 million. Number of people who live in a rural market in America, it's 60 million. So she's literally got double the market that everybody was so hot on for Livongo. She's literally got that. They're just spread out differently.
Well, they're spread out. And they are less healthy than urban populations, probably on average, right? But it's and there are obviously a lot of things going on there that haven't been treated. There's a lot more opioid abuse.
The other little fun fact on this that I thought was really interesting, she said that there are basically 7 health plans that cover 90% of rural people who are on Medicare. So she's got one of them now. So really, truly, hey, if you want to get, there's a business to be done here. And if anybody can do it, sure.
Yeah, let's wish her and the gang there a lot of luck. And hopefully, look, what do we know? We know that access to care and access to a lot of stuff in rural America is a mega big problem, as we've been living with the cities, and we joke about flyover states and whatever, but that's where we have a lot of issues. So they're doing God's work with a venture capital bent. So let's hope Homeward does work.
Yeah. Well, if you want to take a look at that interview that I did with Jenny, or find any of the other WTF Health interviews that I do, you can follow along with me on Twitter. Of course, you can follow along with Mr. Holt. He's doing similar stuff over there at BoltyBoy on Twitter. And to never miss an episode of any of this, head on over to the healthcareblog.com and sign up for our email newsletter and get these delightful little health tech deals episodes and all of the other content delivered directly into your inbox whenever we feel like sending that out. Hey, happy birthday. Last word for you. Happy birthday.
Thank you. I'm getting younger and more beautiful by the day.
You getting any wiser? Because that would be helpful.
Yeah, let's not get too excited.
Don't worry, I'm not. All right, we'll talk to you guys soon. Bye.